So you shouldn't be surprised if you haven't heard about this, because almost no one has heard about it, because the Biden administration has deliberately tried to keep it as secret as possible, and the mainstream media is not covering it. So thank you so much for covering this. So what happened basically is that the Department of Health and Human Services of the Biden administration submitted a set of so-called amendments to a 2005 treaty, which are, if passed, and it looks like they're going to pass unless we take some action immediately. If they are passed, it will seriously undermine and damage the sovereignty of the United States. So, what these amendments do is they are an amendment to a 2005 treaty where everything was voluntary. They make a lot of the stuff that was voluntary mandatory. And one of the things that it does, for example, there's a provision that is within the 2005 treaty that is stricken from the amendments that requires the WHO to have the consent of the country where the health event is happening in order for the WHO to take action. So just with that one striking of that, it means the WHO, and it's really the Director General of the WHO, which is Tedros, will have the ability to come into a country and take action on a so-called health event without the consent of the country. They don't define a health event. So it could be anything. It's anything that affects public health. Okay? Could be a pandemic. Could be gun violence. Could be climate change. Could be mental health. Could be anything that they want to say is a health event. So basically, they can do anything that they want and just come into the United States and effectuate their will. They've established something called a compliance committee, which is appointed. Who's going to appoint them? Tedros? Do we trust people that Tedros is going to be appointing? And by the way, whoever gave the World Health Organization the authority to do this, they are not an elected body. They are just an administrative body. They're supposed to be advisory, helping governments. They're not supposed to be dictatorial over governments. WHO is an arm of the United Nations. We do not want the United Nations dictating our healthcare in the United States. And they are deeply in bed with China. The United Nations is, the WHO is. We saw this in the way that they handled the pandemic, particularly in the beginning, where the WHO went along with China's lies that there was no evidence of human-to-human transmission. And also they opposed Trump's decision to stop international travel from China, saying it was racist. So what that did is it enabled the virus to be spread all over the world. The WHO just worked hand in hand with the Chinese Communist Party to cover up their malfeasance, and the result is that millions of people died. Why should they be entrusted with international health care? So the Biden administration tried to hide it. Somebody found it, and so now people are trying to raise awareness, but it's almost too late. It's like it's like the horse has left. You can't bring it back. The one thing I would say is, even if it does pass, we have a 6-month grace period, and we need to take every action we possibly can to stop this in the United States and worldwide. I had mentioned there's a compliance committee that is going to be appointed, no doubt by Tedros. And they're going to have the power to monitor compliance within a nation and to facilitate compliance. Okay, so how are they going to monitor? How are they going to monitor our efforts if it's not through something like a vaccine passport, smart health card, digital ID? What this is going to do is it's going to give the World Health Organization the ability to surveil all of us in a way that's going to be very similar to the vaccine passport, which is the same platform as the China social credit system. Everything can be attached to this. It's It's a tool of totalitarian control and mass surveillance. And then they can facilitate compliance. So let's say the WHO says, you need to vaccinate everybody, you need to lock everybody down, anyone who's not vaccinated needs to be quarantined, or how about this, everyone who's not vaccinated is suffering from some kind of a mental illness, right? I mean, they could say people who question election integrity, who think maybe that there was some form of election fraud in the 2020 election.
Yeah, they're psychotic.
They're psychotic. I mean, there was already a bulletin from, it was from the, let's see, it's from the National, it's right here, the National Terrorism Advisory System. National Terrorism Advisory System that said that people who think that there was election fraud or who take issue with the COVID narrative are domestic terrorists.
Wow.
So these things are working together: the domestic terrorism thing and this WHO power grab to really impose globalism on the United States and the world.